Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer from Douglas County. Today is June the 22nd, and we're doing another Facebook Live update. This will be like most Facebook Live updates, which is a time for you to ask questions. So on the chat section, put the questions. If we get to them today, we will. If we don't, then I'll answer them later. This is sporting my new balaclava here. It really works quite nicely. I'm going to take it down, though, so that people who read lips can see what's going on. So this has become my new fashion statement. I'm not very fashionable, so it doesn't take much of a statement. Anyway, so as we usually do, we start off at the top, at the world level, and then move down to the country, the state, and the local level of what's going on. And I will tell you, as a world, this is a very active pandemic. It seems like every time I come to you, we're at another million mark, and we're now at the 9 million mark. Very active. We had 183,000 cases yesterday. So in one day, 183,000 cases. It took many, many weeks for us to get to the first 183,000 cases, and then we had 183,000 cases in one day. Still very active in Brazil, Russia, India, but also in Peru and Chile. And so this is very worrisome that Chile, who is going through early fall weather, is having such a bad time of this, and suggests that come our fall that we may similarly have a bad time with it. We're also seeing a big increase in cases in Pakistan and Bangladesh. These are areas with many, many people. These countries are very populated and have really big cities where this could spread quickly. These are countries that have really otherwise third world conditions with not very much testing and not a lot of medical resources. So as a world, it's very worrisome when I see the big increases in cases in Pakistan and Bangladesh. Now, people have said all along that, oh, this must just because we're doing more testing. But if that's the case, then what you should see is the death rate would go down. So if you had deaths or deaths, so if you had a death rate and finding more and more cases, what you should see then is the death rate should come down. And the death rate worldwide is still over 5%. Suggesting that this is not solely due to new case finding. It is that there truly are more cases circulating. In the U.S., we're now at 2.4 million cases and 122,000 deaths. Again, remember on the death rate, that's almost exactly a 5% death rate, suggesting that the increase in cases in the U.S. is not mainly due to new case finding. There is, but is mainly due to the fact that we're having more cases circulating. Our test positivity is still very high. Overall, we're at about 9% test positivity. So that means that for every one positive, we only have 11 negatives. We really should be having 20 to 50 negatives for every positive. In the U.S., California, Texas, and Florida each had over 3,000 cases yesterday. When you have 3,000 cases in the state, there is just no way you could do enough contact tracing, you could do enough case investigation to have this under control. And if you're supposed to have 20 to 50 negative tests for every positive test, that would be between 60 and 150,000 tests in one day in each state. And we're only doing we're not doing anywhere close to that. And so I think I'm starting to see a slip from control to out of control in Florida, Texas, and California. In addition, Georgia, Arizona, and North Carolina also had just an enormous number of cases, so we're concerned about that. In Oregon, still remains very active. We're averaging over 150 cases a day over the last week. So for those of us who joined before, you'll hear this, but we had a little rise in cases, which peaked in March and early April, and then went down, so that by the end of May, about the 15th to the 20th of May, we were having 20, 40, 70 cases a day, a really low number. May 15th, we opened up. By the end of May, we started seeing an increase in cases, and now in June, we're averaging this high number. We had over 500 cases this weekend, really an enormous number. Now, some of those are related to outbreaks. Big outbreak in Churchill and Grand, big outbreak in Newport, and a big outbreak in Oregon State Penitentiary, but none of those cases count in this weekend. These 500 cases over the weekend were really new cases, and they were very widely spread through the Multnomah, Washington, Marion County area. They had almost 100 cases in Multnomah County yesterday, and again, at 100 cases, it's pretty hard to imagine how you could track those all down. But this is the weirdest of diseases because in Douglas County, we don't think there's any locally circulating disease. We're now at the low 30s in the number of cases, and all of our cases in the last 3 weeks have been cases where we know where they got them. People visited somebody out of state, or somebody from out of state came in, they were sick, they gave it to somebody in the area. So all the cases in the last couple of weeks have been related to cases that people got out of state. Well, since we can't ban travel and we don't ban travel, and people do travel up and down the freeway and come to visit us, and we go visit places and then come back, we are going to see some of those cases. And it's a little spooky to see so many cases around us because we know this could spread. Now, an interesting study was done by Oregon State University where they went around and checked people in a neighborhood, several neighborhoods in Corvallis, in a scientifically valid way. And so they did it in Corvallis and they did it in Deschutes County. And it was less than 1% of the people are positive when you look at asymptomatic people in those areas. And in some places it was even far less than 1%. So it's not widely circulating where it's not widely circulating, but where it's widely circulating, it's widely circulating. So for example, in LeGrand, when they sampled the people in that church, 27% of the people were positive. And some of those people are sick in the hospital and otherwise ill. So we do worry about this spreading because there's no sense that if this is in LeGrand, it couldn't also be in Roseburg. So put your numbers in, put your questions in, and we'll get to them. So Veronica says, we go to OHSU on Wednesday. If I was exposed and got it, when could I pass it on? So the typical story on this disease is the incubation period. That's the time between the time you're exposed to the time that you start to have the disease is between 3 and 12 days, with a big peak at 5 or 6 days. We know that people can be contagious from early on the 3rd day through the 4th and 5th day, so that you would usually be, if you got contagious, you'd usually be contagious within a few days. But it can be very, very long. It can be as much as 8 or 10 days. So we think if you've been exposed, you really need to stay quarantined for 2 weeks. So Linda asks, why is OHA a day behind DPHN in cases? And the answer is that OHA pulls their cases at midnight. And we pull our cases as close to noon as we can. So any cases that come in between midnight and 10 or 11 when we do it are going to be counted on our numbers and won't get counted on the OHA numbers until the next day. This is only because, I mean, we could pull the same numbers as they do, but then we would also be a day behind. So when you see our noon updates, those noon updates are accurate until about like 10:30 or 11, which is the last we can pull it. And very few results come in at that part of the morning. So that's why our numbers are always accurate and OHA is sometimes a little bit behind. Because there are 36 different counties in the state, there was no way we could find a time that would work for everyone. So they pull them at midnight. We pull them as of 9 a.m. or 10 a.m., which is the latest we can do that. So a couple of new things that have come out about the disease in the last 2 weeks. One is about the use of decadron. So decadron is a steroid medication, or corticosteroid medication. That's widely used. It's been used since I've been in medical school, as my kids tell me, in the last millennium, but 40 years ago. And so it's a long time. And it's a steroid. It works well for many of the things that steroids work well for, asthma, other kinds of inflammatory conditions. In pediatrics, it's widely used for croup. And so when I was training, we didn't really use anything for croup. And kids would croup for days and days and days, and it would be really miserable to be on a pediatric ward and hear all these kids with the kind of cough. And the only thing we did for them then is put them in this mist, and they would just be miserable because they would be in this cool, misty environment, coughing away. And their parents would be similarly miserable watching their poor kids suffer. Well, about 20 years ago, it was recognized that if you gave kids a single dose of decadron, that you could tremendously decrease the number of hospitalizations. And indeed, hospitalizations are down by about 99% for croup with the use of decadron. So I have a lot of experience using it. I probably used it 1,000 or more times. Safe, effective, easy, cheap. So it's been a great drug for croup. And now they come up with the same drug that they're using for COVID. It's again amazingly, the same dose that I use for croup, 6 milligrams, is the dose that I gave to adults. So not a big dose. In kids, it's a big dose, but for adults, it's not a particularly big dose. And 6 milligrams a day for 10 days. And what they noted was that for people who were either on ventilators or people on oxygen, they got better, a lot higher percentage than others. That's a little bit funny because just that day there was a study that came out that suggested that other steroids didn't work. So I don't know exactly what to make of it. But this, if true, is going to be a big difference. The other new big differences in the disease is that there are other therapeutics in the monoclonal antibody class. These are monoclonal antibodies which attach to the germ and don't allow the germ then to circulate. They've had some success there. So there's a couple of new therapeutics on the horizon, and I'm pretty excited about that. In terms of vaccines, they're moving forward. You can't really tell if they're making progress, but they're moving forward. So typically what happens with vaccines is you do a phase 1, you look to see what's going to happen, you look at the data for a couple of months, and you say, well, that was pretty good. Let's go ahead and invest now in enough new vaccine to do phase 2, and then you do it. And that's why vaccine development can take years and years and years. On this vaccine fast track that they're using now, what they're doing is while they're doing the phase 1, they're making the vaccine for phase 2. They don't proceed to phase 2 until they have all the safety data in, and similarly, they won't proceed to phase 3 until they have the safety data in. So I think it's going to be a safe process. It's a potentially risky process because you could make all this vaccine and then find out it didn't work, and so you may waste some money. But I think right now, we're okay with wasting money as long as we can get a vaccine sooner. So I'm excited about vaccine development. Again, this is a tough germ to make a vaccine for. We've never made a vaccine against the respiratory coronavirus, and the mRNA vaccine, which seems to be the leading contender, we've never had an mRNA vaccine approved. So it's risky, but all the stuff we do is risky, and waiting is risky, so we'll see. So Stephen says, do you know the percent or number of hospitalizations? I do. So if you go to the OHA site, they'll give you the number of hospitalizations, the number of people in the ICU, and the number of people on ventilators, both for those who are confirmed cases and those who are suspect cases. And when I look today, the numbers are up a little bit. They're not up hugely. So the numbers in Oregon are in the high double digits, but it's going up slightly, and that worries us. It also worries us when we see more severe cases, and we're continuing to see deaths. Now, most of the deaths are very old people who had underlying conditions. We've not seen a lot of deaths in younger people. We've not seen a lot of deaths in people without underlying conditions, and that's okay. So I think we're still in control here in Oregon, but when I see these huge number of cases and the enormous number of cases in these other states, I worry that control may be slipping through our little fingers here. Okay, we have a couple of other things here that people had wanted me to talk about. One was about ribavirin. So ribavirin is an antiviral drug which can be used for other viral illnesses. It was tried by the Chinese for this virus that did not seem to be particularly helpful. There's more new out about blood types. It does appear that blood type A is a risk for worse disease, and blood type O is a protective factor. We're not sure exactly what's going on there, but it does seem to be true. So where do we find the numbers by zip code? So the numbers by zip code are in the weekly demographic report. So the weekly demographic report that comes out on Wednesday and Thursday has the numbers by zip code, and they go through every zip code in the state, and they'll tell you the numbers by zip code. Now, in our areas, I don't think we've had any zip codes with more than 10, so they're going to be reported as 0 to 9, but they're pretty much spaced through the county. I mean, when we've looked, there's not one part of the county which is more affected than others. And right now, the zip codes that are important are zip codes outside the state of Oregon, and we don't do, and so you can check with the states around us, but that's not really the issue at this point. Oh, so Barb says, I work at an assisted care facility. We don't have a medical director. Is there any chance you could do it? Oh, well, I'm flattered to be asked, but as a pediatrician, I don't do a lot in assisted care. But we should be able to help people find out and stay in compliance. there is a lot of new rules coming up for schools, new rules for childcare, new rules for sports, and new rules for long-term care facilities about all these things that they're going to do. So if you want to, we can chat about it, but I don't need another job right now. So Sarah says, yeah, if this is as contagious as we've been told, why haven't we seen enormous spikes with the 60,000 or so that attended protests? This is really, really interesting. And we don't know the answer to this because when we look at the new cases in Oregon, they're coming from places that didn't have a lot of protests. And they're in different demographics from those people who we would think might have been protesting. So if we think that the protesters tended to be younger, tended to be less white, and they tended to be in the bigger cities, that's not where we're seeing the increase in cases. We're seeing them in other areas, especially in older people who would not have expected to have been at the protests. Now, when you look at the protests, they were clearly at risk, right? A lot of people together, a lot of people yelling and screaming, presumably making a lot of droplets, but they were outdoors, and looking at the videos of it, there was a lot of milling about, so that people weren't in one place at any one time. They were walking and people were milling around, which we think is a moderate risk activity, but not nearly as high risk as being indoors. What I want to find out is whether there are any cases related to the Trump rally, because they were indoors. They were indoors for a long period of time, over 2 hours as the president spoke. And there was a lot of yelling and cheering and not much social distancing and not much milling about, because at a presidential event, you can't do that. So I've been to a few presidential events over the years, and basically you have to get there early, sit in your seat for a long time until the president gets there, not allowed to move very much, probably for safety, and then need to stay there until the president leaves. So it'll be interesting to know if there are a lot of cases associated with that. Now, again, that was on Saturday. If, let's say, you got exposed, you would probably not have symptoms for 5 or 6 days later, another day or two to figure out you needed a test, maybe another day or two to get it back. So we would think 10 days from the event is when you'd see the big spike. But we haven't seen the big spike in the protests, and I don't know. It's possible we're missing it, but it's also possible because it was an outdoor event with milling about, it was less. So Kenner says, if my chiropractor's office is being careful, is it fairly safe to go in for a visit? And the answer is that any medical place, medical, dental, chiropractic, if the places are being careful, I think this is a fairly safe time to go for a visit. Now, again, there's no zero risk activities, but if they're wearing masks and washing hands, staying home when they're sick, and you're doing the same, then the risk is relatively low. And if you need your chiropractic visit, it would get it done. So I've told people I had a dental cleaning scheduled a few weeks ago, and the dentist was doing everything right, and my teeth needed cleaning. So I went in for dental cleaning, and I would do that if I needed to get it done. Now, would I go in for something that was truly elective? Maybe not. So you might want to put off stuff which you really could do later. But teeth cleaning, the teeth are not going to clean themselves. Okay, a couple more things that we have here. We do need to leave a little early tonight because we have a city council meeting tonight. So a couple of things about kids and school. So kids in school, I think, is a super important issue, because I think most places want to open back schools up in the fall, and they're very worried that, like many diseases, kids will spread this around and really cause a lot of spread. So we've talked about it a few times now, but it appears that schools are relatively safe, that when schools have reopened in other places around the world, now New Zealand, China, Japan, Korea, Denmark, and France, that kids are not associated with a big spread. So it looks like kids are protected in 3 ways. One is kids don't get it as often as you'd expect. So in a regular disease like flu or strep throat or coronavirus or whatever, or other coronaviruses, kids get it more than everybody else. And in this case, kids get it less than everybody else. So whilst you might expect 10% of the population to be kids, in most populations, only 2 or 5% of the cases are kids. So kids get it less often, they tend to get sick less often, and they tend to spread it less often. So again, in France, where they carefully looked at this, in schools, it appears that most kids have gotten it from their parents rather than classmates. And when kids did go to school and were found to have it, they didn't seem to spread around. So that's good news for us reopening schools. Do you have one here? Did you drop it? Oh, okay. So do we know of those who tested who was asymptomatic, and could the increase of cases possibly be due to having a test prior to surgery? So the three questions here. So the first is there are some tests being done prior to surgery. We've had 2 that are positive. We're not even sure that they're real positives. They could be false positives because people had no other symptoms. Yes, they were indeed asymptomatic. But that's only 2 of the cases. Everybody else was either symptomatic or a contact of a symptomatic case. So again, I'm not a big fan of lots of asymptomatic testing. I would so much rather us to really carefully track down symptomatic people, be sure they all get tested, and then track down all of the contacts of cases and test them. I think the other places in the world that got this under control, they did it that way. We're one of the few countries that have done a lot of like asymptomatic before you travel or asymptomatic testing to go to work at the White House. We're one of the few places that have done that. And by looking at the Corvallis study that was done again in Corvallis and Deschutes, if there are not a lot of people around with symptoms, asymptomatic testing is not all that worthwhile. And the tests are not, the testing materials are more available, but they're not widely available. Every day there's shortages of one part of something or another, and they're not cheap. They probably at a minimum cost $100, and some of them cost $200. So they're relatively expensive tests. And so again, I would much rather focus on symptomatic people, every symptomatic person, and then people around them. So Linda says, why was a Corona app placed on cell phones? And so, cell phones are amazing in what they can do. I pulled up my phone the other day and it said, Google, let me show you where you were in this last month. And it had sort of a track of every place I'd been at. Oh, geez, I didn't think I gave Google the permission to do that, but I guess I did. And it tracked down all the places that I'd been, and there'd been a lot of places in the last month. And so that's on cell phones, and I think it's from the people who do that. There are other tracer apps that people use. We in public health are not using any of those. So we have no desire to go ahead and look on your cell phone where you've been. Not only are we're not going to do that, but we have really, we're technologically pretty minimalist here. We certainly don't have to do that. But there are countries that did. So for example, Israel did track everybody by their cell phones. And they could find that if this person who had the disease and this person who didn't have the disease sat next to each other at a cafe, they would call that person that they sat next to in the cafe and tell them that they were around somebody in the cafe who had that. I guess we could do that, but we're not about to do that. I don't think in our country that would make any sense. Now, there are some people who voluntarily have pulled up Corona apps and put them on their phone so they could be reminded of where they were should they be a case and they say, well, where were you 10 days ago? And they say, I don't know, I can barely remember what I ate for breakfast, much less where I was 10 days ago. And so if people want to do it themselves, we're okay with that, but we're not about to track people down with their cell phones. So yes. So Sandra says, once you are diagnosed with COVID and are asymptomatic at that time, is it possible for you to become symptomatic in the future? Absolutely. And in fact, that's the people we worry about the most. So knowing, for example, the people on the aircraft carrier Teddy Roosevelt, there were a lot of people who were asymptomatic at the time who later became symptomatic. Those seem to be the people who are the most contagious. Similarly, on the Diamond Princess and the Ruby Princess, there were people who were asymptomatic at the time and later became symptomatic. So we do know that there are some people who test positive or asymptomatic, a few days later become symptomatic. Those seem to be the people who are the most contagious. And that's why we wear masks. And the reason I wear a mask is that I could easily be in that pre-symptomatic phase, and I don't want to give this to you, so I wear a mask. And so, yes, if you're diagnosed with COVID and are asymptomatic, as it possibly becomes symptomatic in the future, absolutely. Now, it's not that common. It's not like everybody who is asymptomatic will become symptomatic, because there are people who are asymptomatic and stay asymptomatic, maybe 20 to 40% of the population. Okay, one of the other questions that has come up is about the infection fatality rate and the case fatality rate. So there's lots of different ways to calculate these, but the case fatality rate is how many cases and how many deaths. So that if you look, for example, in the US with 122,000 deaths and about 2.4 million cases, you do the math, it's about a 5% case fatality rate. There are some places that have much lower case fatality rates. So Singapore and Qatar have case fatality rates of about 1%. And then there are other areas that have much higher case fatality rates, up to 10 or 12%. And we think that's because they're missing cases. When you look at the developed world, those numbers are somewhere between about 2 and 5%. In China, it was 3.4%. In the US now, it's about 5%. So in developed countries, that's the case fatality rate. Now, the infection fatality rate, they say, is if you find everybody who has the infection. That would include, of course, everybody who has got a case, but also all those people who are asymptomatic or those people who are symptomatic and didn't get tested. What would then be the infection fatality rate? And that number ranges anywhere from a low of about 0.4 to about 2. I think it's going to range somewhere between 0.4 and 2%. So this would suggest that even in the most developed nations, we're missing a fair number of cases. And I think that's probably true in the US, is that we're certainly not finding all the cases because there are still places in the country where it's difficult to get tested. Thank goodness that's not the story in Douglas County. We're going to be doing a testing clinic again on Tuesday and Friday here in Roseburg, and likely on Saturday again in Reedsport. And so call your provider. You can get a test. If you don't have a provider or can't get a test order from them, if you call Aviva at 541-459-3788, they can go ahead and get you a test. So Donna says, if you're asymptomatic, does COVID lay dormant for long periods of time, or does your body make antibodies and destroy it? So we do not know if this can lay dormant. We do not know of any cases where people who had tested positive were still symptomatic, were still transmissible after 9 days. So we do not think it lays dormant for long periods of time. We do think that what can happen is you can carry RNA from the virus in your nose for very long periods of time. So we've got a couple of cases now where people were positive weeks or months ago, and they've been tested again and again, and they continue to find RNA in their nose. And again, my explanation of that is that's like bugs on the windshield. Clearly they were alive as you drove through them. They clearly are bugs, but they're no longer living bugs that can make other people sick or carry disease, so we think that happens. The question is, on asymptomatic people, does your body make antibodies and destroy it? So even asymptomatic people do make antibodies. So both symptomatic and asymptomatic people, we seem to make antibodies. However, it does appear that people who are asymptomatic have a very mild case. Their antibodies go away very quickly, whereas people who are quite sick with this tend to make more antibodies and they persist longer. That's not surprising. That happens in many, many, many diseases. Okay. I think that's everything I had. So we cannot get done with this without talking about masks. Masks continue to be one of the most controversial things out there, and they really shouldn't be, because it's really clear that masks can prevent others from getting sick. So excellent studies that have been done in multiple areas that have looked at both observational data and statistical data suggest that of the things that we do, staying home when you're sick, probably the most important, social distancing, masks, and wearing eye protection can all help reduce the spread of the disease. So especially helps to prevent the spread of the disease in those people who are developing symptoms but don't yet know they have it. And since there's no way to know that you're going to develop the symptoms tomorrow, wearing a mask can definitely help. So I'd encourage everybody to wear a mask. Now, do you need to wear it all the time? No, I'm here socially distanced, so I don't need to do it. But if you can't assure social distancing, such as the store, you're at a place like a church, or at a place like a rally, it would make sense to wear a mask because you don't want to make those around you sick. So very controversial, I know, but I would strongly recommend that we wear a mask. Okay, well, if there are no more questions, you can put other questions on the Facebook thing, and I'll look at them tonight and get you an answer. But otherwise, we'll be back on Friday. Again, this is Dr. Bob Dannenhoffer with another of our Facebook Live events. Thank you.